Now coming to the second part. What are the complications you face in thoracic surgery? Few early complication includes prolonged air leak. For example, a bulla or a bleb, you can have air leak. Pulmonary edema. This can be in the postoperative period. It can be negative pressure pulmonary edema or reperfusion pulmonary edema or your fluid management. You might have given a lot of volume and there is high capillary hydrostatic pressure and patient might develop pulmonary edema, or the patient can have acute respiratory failure, acute lung injury or acute respiratory distress syndrome. Here your positive pressure ventilation and lung protection strategy plays a major role in avoiding this complication. Infection complications like pneumonia or empyema. The patient might develop hemorrhage, hemothorax or chylothorax. Another important early complication which affects the morbidity and mortality in thoracic surgery is the fistula. It can be bronchopleural fistula or esophageal fistula. Your lobar tension, cardiac anesthesia, particularly when you do a pneumonectomy, deep vein thrombosis and pulmonary embolism, and not to forget the cardiac complication of thoracic surgery, arrhythmias and myocardial infarction. These are all early complications following thoracic surgery. But coming to some major complication which can really affect the outcome of the patient. The potential major complication includes torsion of the remaining lobe after lobectomy. For example, you remove the left lower lobe. What happens to the upper lobe? The upper lobe gets torsion. So this is going to affect the outcome of the patient. Dehiscence of the bronchial stem, particularly when you do a pneumonectomy. Hemorrhage from the blood vessel around the thoracic cavity. These are all the early major complications. But fortunately, these are all infrequent. Other two major complications includes respiratory failure and cardiac herniation. Respiratory failure is the commonest cause of major morbidity following thoracic surgery. This respiratory failure develops when there is inadequate respiratory preserve in the preoperative period. Cardiac herniation, although it is very rare, it is fatal if not quickly diagnosed and appropriately treated. Now coming to the torsion of the remaining lobe after lobectomy. Here you can see the left upper lobe and the left lower lobe. The left lower lobe is being removed due to the disease of the lung. Here you remove the left lower lobe and you can see there is a 180-degree torsion of the left upper lobe. Our left upper lobe is coming as a clockwise rotation and it is coming into the space which is created empty by the removal of the left lower lobe. And because of this, there can be enlargement due to venous congestion, and finally the left upper lobe adjusts to that position. Now coming to the left lower lobectomy, the left lower lobe is being removed and here you can see the left upper lobe is remaining. Then it undergoes a torsion. Here you can see a clockwise rotation of around 180 degrees and the left upper lobe is in a different position. What has happened after lobectomy? Now coming to dehiscence, here you remove the entire left lung. This left lung is totally diseased and at the bronchus you cut open and you do a pneumonectomy. What happened to this bronchial edge? Normally this bronchial edge, if you suture properly, it undergoes angiogenesis and it is secured properly. Here you can see it undergoes tissue formation and it is sealed. But sometimes what happens is there can be a dehiscence of this stem, okay. It may not be sutured properly, or if you give positive pressure ventilation, the air might come through it. So there can be dehiscence and fistula can happen and this can lead to dangerous hypoxia and you may not be able to maintain the ventilation. That is very important. Dehiscence of bronchial stem is a very dangerous complication following pneumonectomy. Now coming to the third major complication, which is hemorrhage from major vessel. Thoracic cavity has lot of vascular structure, be it artery, vein or pulmonary circulation. Lot of vessels are involved. So even if one major vessel is involved, it can lead to a major hemorrhage. Coming to the systemic artery, it can be common carotid or subclavian artery. This is subclavian artery and this is the carotid artery. You might injure the carotid or subclavian artery. These are all systemic artery. Coming to the venous system, you might involve the subclavian vein or the superior vena cava, which is formed by the junction of internal jugular and the subclavian vein, or the brachiocephalic vein, left brachiocephalic vein. Other veins which might be injured at the lower end of the thoracic cavity includes asclepius vein, and inferior vena caval damage can also happen with thoracic surgery. These are all systemic veins which are involved. Now coming to the pulmonary circulation, your right pulmonary artery, left pulmonary artery or the main pulmonary artery and the pulmonary veins also might be damaged, which can lead to dangerous hemorrhage. Other thing which can be involved includes pericardiophrenec artery and vein.